so this is the leg. I should say lower extremity. So in the anterior, anterior compartment of the thigh, we have the quadriceps group. So this is the rectus femoris, okay? Then we have the two vastus. If it's on the pinky side, it's vastus lateralis. This is vastus medialis. To find the vastus intermedius, you just basically pick this up. It's not easy to do, but it's underneath, okay? So vastus intermedius would be under here. Out of the whole quadriceps group, the only muscle that crosses both the hip and the knee is the rectus femoris. The rest of the vastus group just crosses the knee joint. And remember that they go basically inserting into the tibia via the rectus femoris tendon, and then, quadriceps tendon. And then from the patella down to the tibial tuberosity, you have the patellar ligament. At this superior compartment, area, you have the tensor fasciae latae laterally. The tensor fasciae latae basically inserts to this long iliotibial band. Then if we move medially into the thigh, inner thigh area, we have basically your adductor group. So we have the adductor group, well, then I'll talk about these two, but this is a little guy right here called the pectineus. And then next to the pectineus, we have the adductor longus. And then next to that, we have the long gracilis. And then the muscle that you see underneath the gracilis here, that's the all adductor magnus. Okay? So what we left out here is the iliopsoas that you can see at the top. And on the other leg model, you can see the psoas major and you can see the iliacus separately, and then they come together, basically the iliopsoas here. Then you have the long sartorius muscle. And then this muscle crosses both the hip and also the knee as well. As you move, I guess we'll go from the side to the posterior thigh, we have our hamstring group. The hamstring group are three muscles, all originating on the ischial tuberosity. And they basically are the lateral rectus femoris, the medial semitendinosus, biceps femoris, thank you. Biceps femoris, semitendinosus, and then you have the semimembranosus deep to the semitendinosus. So you can see some semimembranosus there and also along the side. Then we have up here, we have the gluteus maximus. If we take the gluteus maximus off, what we are able to see on the models is the gluteus medius, and then we also have the piriformis. And those are the only two muscles that you're responsible for underneath the gluteus maximus. We can see the piriformis landmark, the sciatic nerve coming from underneath it. Okay, so moving down to the leg. So we can see in the leg, oh, someone taped this. Okay, so we have the tibia, and then next to the tibia we have the tibial tuberosity. I'm sorry. The tibialis anterior, I'm getting tired. The tibialis anterior, as we rotate laterally, we see a long muscle here. So this is the extensor digitorum longus. And then we have a smaller muscle beneath it, and that's the extensor hallucis longus. So these move digits 2 through 5. This one is just for your big toe or digit number 1. Moving back even more, so right down the lateral side of your leg, you basically have your fibularis longus and your fibularis brevis. You could also say peroneus longus and peroneus brevis. And then rotating towards the back, we have the back of your leg, and basically you have two heads of the gastrocnemius. You have a medial head and a lateral head. If you want, take a look at your toes to orient yourself to what's medial and what's lateral on this. And then, so then you can see the soleus underneath, which is why that was on there. So the soleus, you can see, if I take this off, you can see the soleus. You can also see the soleus here and here, basically along the sides of the gastrocnemius. I can't take this off because someone taped it. So, yeah, so I don't know who did this. Anyways, you can see it okay here. So there's one, two, three muscles in the deep posterior compartment of the leg that you should know. So The one that's kind of smallest and tucked behind these two, that's the tibialis posterior. Then here you have the flexor hallucis longus, and then you have the flexor digitorum. Okay, and those are the three that you need to know. Now, I should say that on the other model, the larger leg model, what you can see back here is the plantaris. So if I had these guys on together and in place, the plantaris should be in here. And I guess there's a little bit of a bump here, but there's a number with a very distinct plantaris on the larger leg. And that's it.